So I think that that's the other shoe that's likely to
Documented immigrants.
California is looking at. They spend the most amount of money on their Medicaid system called Medi-Cal in California.
And really rolled out the red carpet for illegal immigration here when they said
coverage, access to Medicaid was offered to children, undocumented children in the state.
That would be about a $3.1 billion a year hit to the California budget.
Sustainable, it's unacceptable. We're about to spend $12 billion on this crisis.
Despite the financial strain, Governor Gavin Newsom is pushing to cover even more undocumented immigrants, expanding the financial burden on the state. One notable aspect is the potential role of federal support in alleviating California's budget woes. Chuck mentions that Biden's declaration last April stating that DACA recipients were legally present in the country helped offset California's deficit by $1.1 billion. He speculates that if Biden extends a similar declaration to all individuals rushing across the border claiming lawful presence, it could further burden U.S. taxpayers by $11 billion annually in the state portion of Medicaid. The discussion emphasizes the impact on taxpayers and the potential consequences of such policies. Chuck criticizes the idea of the broke federal government bailing out Californians on behalf of undocumented immigrants. He argues that this approach may incentivize more people to cross the border without considering the legal obligations for those seeking entry into the United States. There's also a broader call for Americans to reflect on existing laws regarding immigration. The argument is made is that individuals entering the country, unless legitimate asylum seekers, should not be a burden on the system. The existing laws suggest that immigrants should demonstrate their ability to take care of themselves, and having sponsors is typically required for legal entry. The concern is raised that the current influx of individuals at the border does not align with these legal expectations. The controversy surrounding California's decision to expand healthcare coverage for undocumented immigrants revolves around its financial implications, exacerbating the state's budget deficit. The potential role of federal support in offsetting these costs adds another layer to the discussion, prompting concerns about the impact on U.S. taxpayers. Additionally, there's a call for a reevaluation of existing immigration laws and their enforcement to ensure that individuals entering the country do not become a burden on the system. California's immigration healthcare. California Governor Gavin Newsom has recently announced a significant expansion of healthcare coverage for illegal immigrants in the state. This move aims to add approximately 764,000 more individuals to California's Medi-Cal program, with an estimated annual cost of $3.1 billion to the state's taxpayers. The decision is part of California's broader initiative to achieve universal health insurance coverage. The expansion comes amidst a larger national conversation about immigration policies and their implications on various aspects of public services. Tanner Aleph, the policy director for the Right on Healthcare, expressed concerns about the move. Aleph pointed out that while California positions itself as a champion for healthcare justice, its Medicaid expansion efforts have ironically led to reduced healthcare access for low-income individuals in rural counties.
Expansion, more than 700,000 people between the ages of 26 and 49 will be eligible for Medi-Cal.
DACA recipients were in the country legally. They were legally present in the country.
California expands access to care for undocumented immigrants. New York appears to be taking a more aggressive stance.
Because they don't have access to these resources, they wait until the very end to hopefully receive some care, and by then it's too late.
So I think that that's the other shoe that's likely to drop, given how loyal Gavin Newsom has been for President Biden.
They're feeling ill to go to the doctor. We should have preventative care, and that's why this is so important.
Newsom's California brings a $3 billion bill to taxpayers in yet another handout for illegal immigrants.
Between 2016 and 2019, there's a significant decline in the number of physicians in California's rural countries accepting Medicaid. Furthermore, Aleph highlighted the challenges faced by healthcare providers. In 2023, the California Hospital Association reported that 1 in 5 hospitals was on the brink of closure due to losses from the state's Medicaid program, Medi-Cal. This indicates that Medicaid is putting healthcare providers out of business, raising questions about the effectiveness of providing taxpayer-funded Medicaid cards if there's a lack of available healthcare services. The decision to expand health coverage for illegal immigrants aligns with California's broader policy goals, particularly its commitment to providing comprehensive health care access. However, the potential repercussions on the state's healthcare infrastructure and financial stability are subjects of ongoing debate. As California grapples with a significant budget deficit, the allocations of funds to expand healthcare coverage for a larger population raises questions about the state's financial priorities. Critics argue that such expansions should be accompanied by measures to address existing challenges within the healthcare system, ensuring that increased coverage translates to improved access and quality of care. In supposition, California's recent move to expand health coverage for illegal immigrants reflects its commitment to inclusive healthcare policies. However, the concerns raised about the impact on healthcare access in rural areas and the strain on the state's budget underscore the complex dynamics of implementing such initiatives. The ongoing dialogue around healthcare justice, budget priorities, and the sustainability of Medicaid programs will likely shape the future trajectory of healthcare policies in California.
Of California adults supported healthcare coverage for undocumented immigrants.
Now everyone in the middle gets it as well. Where are they getting the money for this, and what's this going to do to illegal immigration?
Presumably with the belief that it would be unethical and wrong for children to be dying of preventable diseases in the street.
Governor Newsom's doing is he's saying, let's cover all the rest of the illegal immigrants that we don't already cover.
Creates the opportunity to build up the infrastructure you need for all the unhoused folks in the city.
You'll come into the arrival center, store your luggage, you receive your next assignment.
Economic implications for California. In response to the announcement by President Biden regarding additional tax money allocated to sheltered migrants, there are growing concerns and discussions about the economic implications for California. The decision, which aims to address the needs of migrants entering the United States, particularly in providing shelter, has raised questions about its impact on California's budget deficit and the potential consequences for taxpayers. California is currently facing a significant budget deficit of $68 billion, a financial challenge that has prompted calls for early action and careful consideration of expenditures. Senator Roger Niello, along with Republican colleagues, has expressed the need to address this deficit proactively. Regardless of one's stance on the expenditure of sheltering migrants, there's a shared recognition that adding such costs to the existing budget shortfall might not be a prudent move. Furthermore, the announcement suggests that a similar approach with millions of other illegal immigrants could result in an additional $11 billion in federal Medicaid assistance for California. This has sparked discussions about the potential consequences of using tax money to provide a federal bailout for the state's spending practices. The underlying theory is that the paperwork given to illegal migrants by the Border Patrol as they await their immigration hearings might be considered a form of lawful presence, making them eligible for federal assistance. The decision to allocate tax money to support the needs of migrants raises broader questions about the influence on behavior and migration patterns. The Heritage Foundation's Nina Aucharenko-Schaefer has cautioned that California's generosity may attract more migrants to the state. This consideration introduces the possibility of partially offsetting California's recent population decline, which has seen residents leaving the state for 3 consecutive years. Additionally, there's a potential federal impact as the Biden administration's actions might offer assistance to offset the costs incurred by California.
Immigrant rights advocates call the expansion of health care for undocumented immigrants a major milestone in California.
Tend to go to states that offer a lot of public resources like health care. So in this situation,
right, and of course it serves as a magnet. It causes even more people to come in.
700,000 illegal immigrants between 26 and 49, eligibility for full coverage.
Well, that helped offset California's deficit, I think, by about $1.1 billion.
That more will come to states like California, especially because crossing the border there is a lot easier.
The president has done more to secure the border and to deal with this issue.
The interaction between federal and state resources raises questions about the broader implications for immigration policies, fiscal responsibility, and the economic landscape. In conclusion, President Biden's announcement of allocating more tax money to shelter migrants has ignited discussions about its economic implications for California. The state's budget deficit, ongoing population decline, and the potential influence on migration patterns are central points of concern. As policymakers navigate these challenges, the decisions made in response to the sheltering needs of migrants will have lasting effects on both the state and the broader national conversation surrounding immigration and fiscal responsibility. That's going to do it for this video, guys. See you next time, and bye for now.